Good morning. I've been both a patient and a caregiver, and at times I actually found it easier to be the patient. My cancer journey began in 2008 when I was diagnosed with stage 3 melanoma, the malignant form of skin cancer. After living away for almost 15 years, I had moved to Connecticut less than 2 years prior for a job opportunity and to be closer to my mom, who lived in Rhode Island, which is where I grew up. It was ironic, since part of the reason I moved back to New England was to be there for her as she got older. My mom raised me as a single parent, and I'm her only child, so we always had a strong bond. I work at a university that has a health system, so I was very fortunate that my care was well coordinated between my providers and insurance, because I was completely clueless how to navigate this process. And my mom was close enough to be there with me for doctor's appointments. My mom was always my rock. She was optimistic, she was hopeful, she was quick to laugh, and she was actually also very healthy. So it came as a shock in 2013 when she was diagnosed with lymphoma, because she'd been experiencing no symptoms such as weight loss, difficulty sleeping, night sweats. Her cancer was determined to be very slow moving, so the only treatment was that she would go to the doctors every few months for blood tests and checkups. So she did just that and continued to live her happy life for 2.5 years. In August 2016, the original lump on her neck began growing pretty quickly. This was when the cost of care started to have an impact, particularly in how the health system is organized. When I was a patient, I felt my job was to get well. As a caregiver, I was constantly worried that not enough was being done to help my mom. A retired teacher, she had good insurance. Medicare was her primary, and she had kept her teaching insurance as her supplemental. Though she had good insurance, the process was not streamlined, and it took several weeks before determining treatment, because for each step, the doctor had to get approval from Medicare, and if that wasn't covered, approval from the supplemental. All the while, the lump was visibly growing. Her cancer was a rare form called triple-hit lymphoma. Less than 2% of lymphoma patients are diagnosed with this type, and the average survival rate is less than 2 years once it becomes active. The protocol was my mom would be hospitalized every few weeks for 5 days to receive a potent chemo cocktail. This was a standing order, so again, one would think it would be streamlined each time she was admitted. It was far from that. There were times my mom arrived at the hospital in the morning and treatment didn't begin until after dinner. There were other times she arrived in the afternoon and treatment didn't begin until the next day. I called the nurse manager because this process was the complete opposite of compassionate care and created such high amounts of anxiety for my mom. The manager understood our frustration, but said the process couldn't be changed. After about 5 months of treatment, my mom's scans were clean. However, we learned by the beginning of summer that the cancer had returned and the tumor was bigger than before. I won't go into all the details of the next several months, but from a process and procedural standpoint, it was more of the same. Countless hours waiting in the doctor's office, battles with the insurance companies to get the scans, and so on. My mom held on to her hope that there would be options, and she was prepared to continue fighting. I truly believe her wonderful spirit kept her going as long as she did. The week after Thanksgiving, she was back in the hospital with immense pain, and palliative care suggested hospice. Knowing what I know now, I so wish we had had that type of support sooner, because this was the most coordinated aspect of her care. My mom asked the palliative care doctors if she would make it to Christmas, her favorite holiday. They kindly, but honestly, said they didn't know. My mom came home under hospice care on December 5th, 2017, and died 6 days later. Having hospice allowed me to keep her at home, and she was able to enjoy her Christmas tree while people visited. The United States does have some of the best healthcare in the world, but being sick in this country is incredibly difficult. When someone is sick, the primary focus should always be how to make them well, or at least comfortable. I hope to advocate because I want others not to have to experience the worry, concern, and anxiety of managing the system more than the care of their loved ones. Patients, families, and healthcare providers deserve better. Thank you.